Hi, this is Jennifer Glen, Chief Medical Officer with eval.health. In partnership with Memorial Sloan Kettering, we've just released new clinical and patient portal features. Clinicians can create an eval, like a patient assessment, email a link to the patient to be completed in a HIPAA-compliant patient portal. The eval results will be captured on the practitioner eval portal for review. So let's take a quick live tour of the workflow. We're going to start on our eval.health landing page. We're on the Marketplace tab. Here you can see publicly available evaluations. As you can see, I am currently logged in, and I'm going to start in the charts feature. In the charts feature, there are panels that you can create. I've got 3 here at the bottom. It's pretty straightforward to build a patient panel. Click on New Panel and create a name for your clinic. You'll be able to select an evaluation that you would like to track and click Save. You can see the primary care clinic is now displayed. We're going to hop into a clinic that's already created, and we land on the results page. You can see there's already incoming results from evaluations that have been completed by patients. We're going to add patients to our panel. Click on the Add Patients button, and as you can see, you can select patients that are already enrolled in your charts feature. You can also integrate with an EHR and import those patients into your panel. You can also click on New Patient and enter in your first patient information. And click Create Patient. There is an identity page where you can add additional information. This is completely optional. I will point out that there is a communication where you can add emails and phone numbers. Let's click out of Sam Lee Anderson's chart that we just created. And we're on the Patients tab of our panel, and you'll notice that Sam Lee Anderson is now a patient. We can click on Sam Lee Anderson and we can schedule an evaluation. Let's click Schedule, and let's click on this tab and select an evaluation. This is where we can schedule a new evaluation. If you have Sam on the phone with you or with you in the clinic, you can also play the app as well. Let's click on New Schedule. So we're going to schedule the erect track, and we have some default daily setting, and you can change those settings if you'd like the evaluation to be completed every day after a set amount of results. And you can add a patient instruction, which is completely optional. Here you can add the email that the account invite and the evaluation reminder will be sent to. Then click Save Schedule. A verification of the evaluation will appear. You can X out of this, and you'll also notice that the schedule appears under Sam's chart on the Schedule tab. You'll also notice an orange icon next to Portal in Sam's chart. This is validating that you've sent the invite to his email and he has yet to connect. So let's take that next step and go to Sam's email address and accept that invite. As you can see, I've switched browser screens and we're in Sam's email account. And as you'll notice, he has an eval.health portal invite that he's received. And this is from scheduling the evaluation. And this is what that will look like. And as you scroll down, you accept the invite, and you're directed to the me.eval.health patient portal to begin setting up the account process. The invite looks a lot like this, and to start, we'll click Sign In. Next, create free account. The patient will then fill in their information. The patient will then create a username and password. Next, enter the email. Then click Send Code. We'll go to the email browser and find the code. We have a code to enter. And create account. There's one more step to complete. In the first email verification that we completed, the patient was verifying that they owned the email in order to create the account. Now we have the second invite. This step verifies the invitation, and this will be the email that connects the account to the clinical account in eval. This email can be changed, but in this situation, we're going to go ahead and validate that this is the invite email that we want to validate. So I'll send that code, go back to the portal, and retrieve the code. And let's click Verify again, and accept the invite. We are now in Sam Anderson's account, and we'll see he has one evaluation that is ready and due to complete, as well as below the schedule for that evaluation going forward. Let's click on the row and complete the evaluation. Let's answer the questions just as the patient would. We're going to trigger a critical result. And the patient will receive a set of results or instructions, and in this case, a critical one. And at the bottom, they have the option to add in a comment and click Save and Submit. The patient will be prompted to approve sending the results to their clinician. And as you can see, the evaluation is marked complete. You can click on that evaluation and review the results. Additionally, there's a menu option to download those results. The patient also has the opportunity to complete additional evaluations. However, only results that have been prescribed will be sent to the clinician. When the patient clicks New, they'll be notified that their daily limit has been reached, and that if they proceed, the results will not be sent to their practitioner. So let's switch browsers and look at the results on the clinician portal. We're now back at the clinical portal at eval.health, and we're in the sexual health clinic panel. You'll notice that Sam Anderson has been received as a critical result, and the status is new. We can click on the result, and we'll notice that the patient has reported, which is Sam Anderson, a result with the date and timestamp. It's critical and the status is new. You can see the results and scroll down and also see the answers to the questions. Additionally, you'll notice there's a comment section. Click comment, and these comments are private only to the clinic portal. The patient will not see them. Click Save Comment. If you scroll back down, there's also a History tab. This will notate when the evaluation was created and signed, as well as any changes to the evaluation status, or comments. Scrolling up, you can override any of the priorities that come in. You can also mark this as complete. And if you have a clinical workflow that you would like to establish, you can create assignments such as a doctor review or a triage callback. I'll show you how to create those here in a bit. I would like to also mention that in the Actions button, you can download all of the data that you see on this screen into a PDF to print off, or you can copy this text and paste it into your EHR note. If you have an EHR integration, which we do offer, this note can also be written back into a patient encounter in your EHR. Let's click out of Sam's chart, and we're back in that panel. You'll notice that the status is now complete. I also want to highlight that there are boxes at the top that will help you to filter through any of the results as either based on its urgency, what is new or pending, as well as any results that are waiting or scheduled. To clear this filter, simply click on this back arrow and you'll be reset back to the panel default. You can also create your own custom filters if you want to narrow down a certain population subset. You can title your filter and choose how you want to filter that population, whether you want to focus on patient apps, their priority, status as well, and additionally if you have any assignments, and also which apps you would like to focus on. Then click Save, exit out, and you'll notice that your filter has been saved, and you can exit out of that filter, but you'll also see that that filter is now available to select. Once again, click the back arrow to clear back to your default settings. Another feature that's really nice to have is the ability to be notified of incoming results. So I clicked Notifications and click New Notification and enter your email. You can then create a filter of patients you would like notifications from. Once you've selected your filter requirements, click Save, and you have your notifications set up. Another feature are assignments, and you can customize these assignments based on your clinic workflow. Click New Assignment, simply create a title, and click Save. And this is a way to pass results within your team members for further review and disposition. If you'd like to learn more or have any questions, feel free to reach out to us. Thank you.